Hi, I'm Dr. Trent Ryan. I'm one of the doctors here at Concord Medical Spine and Pain Center. And we're going to start up a new series called Friday Focus. It's going to be delivered to you, usually via email, or you might see actually on the internet, on YouTube and things like that. A whole new series that we're going to be producing on a weekly basis, educating you on certain topics of health. A lot of it's going to start with pain and have to do with the spine, but also pain anywhere in the body, from headaches to ankle pain to neuropathies. There's all these different subjects we want to cover and educate you guys and the public in a different way, because we're finding out that there is an extreme lack of communication on what is really going on with these disorders and what are the appropriate forms of care for them beyond just taking, something to patch up the pain. There's an explosion in physical medicine research and treatments that people need to know about, but also really what's going on with these disorders, and how to not just treat it, but how do you correct these things the best you can. So we're going to start a series, and all these Friday focuses are going to be shorter. They're going to give you a certain topic. I'm not going to kill you with a lot of information, but I'm going to give you something to chew on over the next week, and then I'll attach another piece onto that, and I'll talk about different disorders and different reasons for those disorders. So let's start right in with a basic aspect of osteoarthritis today, which so many people are having troubles with, which can start at a very young age from traumas and things like that. We're not talking about rheumatoid arthritis. We're talking about an osteoarthritis. We're not talking about psoriatic arthritis. This is osteoarthritis, or we call spondylosis. This is or degeneration of the spine, which we see every day here at our clinic. The most common thing we see, and we'll see it in somebody in their 20s and 30s practically, if they go through enough little traumas throughout their life and they don't know about this. But as you go through life, you go through stresses and strains, usually physical, some are emotional, some are chemical, but your body breaks down. And unfortunately, you don't necessarily know this osteoarthritis is creeping up on you. And that's what we gotta educate you on to get looked at, to do something about this. Because what happens is it'll creep up on you, and all of a sudden you'll get a symptom, you'll get a pain, you'll get an ache, and it'll go away. You think, well, I'm okay, but actually that is a sign that's coming up on you. And there's simple tests you can do to see if you have this. And there's also great things to do to treat it so you can stop this in its tracks. There's a lot of research and a lot of newer treatments to stop this from progressing. But the sooner you get it, the better you are in the future. You don't want to be that person in their 60s and 70s hunched over and barely walking with all these pains. You get it on early, you can do very, very well. Well, where does this stuff come from? This osteoarthritis come from? What do we know about this aspect? Is it genetic? Well, you can have a genetic link to a weakness that can push that further, but usually the main form is from trauma, and little micro traumas, postural stresses at a computer all day, to maybe you work in your hands, you walk around all day, carry things. It's repetitive use, micro traumas, but also some bigger traumas like slipping and falling on the ice, banging your head on a counter, whipping your neck back and forth. Repetitive use can do a lot of this stuff. So we're all at risk for it. We all have occupations, whether it be sedentary or active, we get into routines that set us up for some failure of these muscles around the spine and ligaments and joints that will get this degenerative process going. But the great news is you can stop this. You can find the problem, find the weaknesses, get the inflammation out of there, and you can do fine in the future. Some basics of this. You get your brain, you got your body. All right, so we all know the brain controls everything the body's doing, but also through all these nerves coming down, but also coming back up to the brain, there's all these wires and nerves coming back to the brain, telling the brain, hey, this is what's going on in the environment. This is how I stand up. This is what all the organs are telling back to the brain. And it's feed forward and feedback information that is so important to understand as doctors. But as you go through life, these stresses and strains I talked about, you get traumas, whether it be directly to your brain, to your spine, to your body. That changes this whole dynamic. And if you go through enough of it, and they can be very minor too, and you don't really know it's creeping up on you, you go through areas of dysfunction in your body. What's dysfunction? Well, it's not working right. Where can it be? It could be in the organs in your body, it can be at the nerves, it could be at the muscles in your body, it could be in the spinal cord, it could be in the brain. And there's more aspects to this I could talk about, whether it be a pH thing, it could be a chemical. There's a lot of different things. It could be a respiratory thing. It could be a lot of things, but the most common are these little traumas affecting your body. the body breaks down, the brain or anywhere in the body breaks down, and eventually you get a disease process. And even in this state, you don't know you got a problem. You don't have any symptoms yet. Because the last things usually to appear as symptoms, like aches and pains of the body, or headache, or neck, back, shoulders, legs, headaches. Those are very, very common symptoms that we see here every day. It could be in vertigo, dizziness. But what's the disease we're talking about today? Osteoarthritis. This is not osteoporosis. That's different. That's the bone calcium thing. This is osteoarthritis. We see it all day, and the majority of society has no idea they have it until... Okay, continuation from my... we got cut off there for a second. Continuation of this talk about osteoarthritis. Here's an example in the spine what it looks like, but it's the same for if it's in your shoulders, it's in your fingers. Basically, your spine's not moving right. There's always little different traumas throughout the spine, and it gets locked up. And when these areas get locked up because the brain's guarding it from moving, you actually lose proper fluid into those discs, because really your discs rely, and these joints rely on proper motion. It's called imbibition, proper motion to pull fluid and nutrients into these discs. So when you go through these traumas, it could be in the spine but also joints, it relies on proper motion. But if it gets guarded because of these little traumas, and you don't know you have those traumas because you don't have a lot of pain yet, but they're locked up, you don't know it doesn't move 100%, it might move 60 or 70%. Well, these discs start losing nutrients, because after the age of 15, give or take a few years for different people, these discs lose blood supply, and it relies on that proper motion to get the fluid in there. Well, if they get locked up from these little traumas I was talking about, and the same goes for any other joint, then all of a sudden these nice wet sponges don't get the nutrients and they turn to dry sponges. And then you get spurs, and then something called stenosis, which is part of arthritis usually, and that will irritate these nerves, and you get scar tissue, and it's inflammation. It's muscle inflammation, it's tendon inflammation, it's disc inflammation, it's joint inflammation, so all these different joints around the spine here, and it gets out of control, and it creates all these chronic pain problems we see every day throughout the population in their 40s, 50s, 60s, 70s, etc. But if you know to get on this right away, to resolve this stuff, to stop it from progressing. If you're looking like this, you can't necessarily resolve to look like this, but you can stop it from progressing, get the inflammation down, and you can do really well. You don't have to progress into the next one, which is fusion. Those are the people you see walking around really stiff and with an awful balance problem and an awful chronic pain. You do not have to be them. So the key is to fight this disease process actively with treating the cause of it, getting rid of that inflammation, getting those areas moving, but also treating the symptoms with specific treatments too. So you really got to attack everything. That's all I want to educate you on with this Friday Focus. We'll continue with different aspects. I'll touch on this again. I think I covered an awful lot today. You might have questions on that. If you have other questions, concerns, you worry about yourself in terms of getting this, because you're getting some aches and pains coming and going. If they go away, you don't think you have a problem, but boy, yeah, you just don't have the symptom. It's here, but then it comes back again. Come in and get a consultation with one of our doctors, whether it be myself or one of our other specialists here, that will take a look at you and see if this is actually creeping up on you. Like I said, this could start up in your teens and 20s practically, but most commonly you'll start seeing it in later 30s, 40s, 50s, and of course later on in life. So come in, get a consultation at our office, and we'll be able to help you out. Until next Friday, see you later.